Welcome to the Quality Assurance and Performance Improvement, otherwise known as QAPI, Phase 3 training. This training will provide an overview of the quality assurance and performance improvement requirements, which went into effect in November 2019. Today, we will cover the new requirements in F865 for the QAPI plan and program, the relocation of the requirements in F866, the new requirements for the QAPI program, including feedback, data collection, analysis, monitoring, and improvement activities, the expansion of the Quality Assessment and Assurance Committee required members, and the new QAPI training requirements. A quality assurance and performance improvement program takes a systematic, interdisciplinary, comprehensive, and data-driven approach to maintaining and improving safety and quality. An interdisciplinary approach encompasses all managerial and clinical services, which includes care and services provided by outside, both contracted or arranged, providers and suppliers. Phase 3 requirements for 483.75A in F865 lay out the requirements of the facility's QAPI program. Each facility must develop, implement, and maintain an effective, comprehensive, data-driven QAPI program that focuses on indicators of the outcomes of care and quality of life. Each facility must also maintain documentation and provide evidence of its ongoing QAPI program. Demonstration of compliance includes, but is not limited to, evidence of systems and reports demonstrating identification, reporting, investigation, analysis, and prevention of adverse events, data collection and analysis at regular intervals, and documentation demonstrating development, implementation, and evaluation of corrective actions or performance improvement activities. Additionally, each facility must present its QAPI plan to state and federal surveyors at each annual recertification survey and upon request during any other survey, and to CMS upon request. Phase 3 requirements also specify that each facility must design a QAPI program that is ongoing, comprehensive, and capable of addressing the full range of care and services it provides. At a minimum, the program must address all systems of care and management practices, include clinical care, quality of life, and resident choice, utilize the best available evidence to define measure indicators of quality and facility goals that reflect processes of care and facility operations that have been shown to be predictive of desired outcomes for residents, and reflect the complexities, unique care and services that the facility provides. Effective QAPI programs address systems of care and management practices. Systems of care, or care delivery systems, are the processes in place to achieve an expected clinical outcome. Facilities may have many systems of care which intersect and involve multiple disciplines and departments. For example, the systems for prevention of pressure ulcers also involves the system for ensuring adequate nutrition, as well as the systems for identification of changes in condition and infection prevention. In addition to systems of care, the facility should also monitor important management practices, such as resident finances and personal funds, admission and discharge practices, and other services that impact quality of life and resident rights. The QAPI program should address quality of life and resident choice by identifying the unique needs and preferences of the varying demographics of residents residing in the facility, such as young and/or culturally diverse residents, and seeking ongoing input and feedback from their residents. The governance and leadership requirements are also part of Phase 3. The governing body and/or executive leadership or organized group or an individual who assumes full legal authority and responsibility for operation of the facility must ensure the QAPI program is defined, implemented, and ongoing, addresses identified priorities, is sustained through transitions in leadership and staffing, has adequate resources, including staff time, equipment, and technical training as needed, uses performance indicator data, resident and staff input, and other information to identify and prioritize problems and opportunities, implements corrective actions to address gaps in systems and evaluates actions for effectiveness, and establishes clear expectations around safety, quality, rights, choice, and respect. Surveyors will use the facility task QAPI and QAA review along with the guidance when determining if the facility meets the requirements for or when investigating concerns related to requirements in F865. Additionally, the key elements of noncompliance for F865 have been updated to include the new requirements discussed. New key elements of noncompliance in F865 have been added. To cite a deficiency, determine if the facility failed to maintain and present any evidence related to the QAPI program, present its QAPI plan to surveyors during recertification surveys or upon request, develop, implement, and maintain an effective QAPI program, or ensure governing body oversight of the QAPI program and activities. You may be wondering what happened to F866, the QAPI QAA data collection and monitoring tag. In the course of writing the Phase 3 guidance, we found that the components of F866 and F867 were similar and intertwined. So we combined the requirements into one tag. Therefore, the requirements from F866 were relocated into F867. With the exception of the requirements for the QAA committee to develop and implement plans of action to correct identified quality deficiencies, most of the requirements in F867 are Phase 3 requirements that became effective in November 2019. As required in 483.75A at F865, the facility must develop and implement written policies and procedures that ensure the care and services it delivers meet acceptable standards of quality in accordance with recognized standards of practice. This is accomplished in part by identifying, collecting, analyzing, and monitoring data which reflects the functions of each department and outcomes to residents. Feedback is one of many data sources which provide valuable information the facility must incorporate into an effective QAPI program. Each facility must establish and implement written policies and procedures for feedback. Feedback must be obtained from direct care staff, other staff, residents and resident representatives, as well as other sources, and can be used to identify problems that are high risk, high volume, and/or problem prone, as well as opportunities for improvement. Feedback from residents is necessary to understand what quality concerns are important to them, their perspectives, values, and priorities, as well as the impact of the facility's daily routines on their physical, mental, and psychosocial well-being. Staff can also provide valuable input into understanding care and service delivery processes. A facility should choose the best mechanism for feedback to support their QAPI program. Examples of ways a facility can obtain resident and staff feedback may include, but are not limited to, satisfaction surveys and questionnaires, routine meetings such as care plan and resident council, safety team, or town hall meetings, and suggestion or comment boxes. Effective feedback systems in a QAPI program also include methods for providing feedback to direct care staff, other staff, residents, and representatives. This may involve including these individuals in problem solving, various meetings, or providing updates and communicating facility system changes. In order to ensure care and services are carried out consistently, accurately, timely, and according to recognized standards of quality, the facility must collect and monitor data reflecting its performance, including adverse events. Facility policies and procedures must address how data will be identified and the frequency and methodology for collecting and using data from all departments. The facility determines what data it will collect to represent its care areas considered to be associated with high risk, high volume, and/or problem-prone issues. Data collection can be done using several methods, such as audit tools purchased or developed by the facility, direct observation, interview, or testing. Sources for data may include the minimum data set, otherwise known as MDS, and quality measures, medical records, survey results, incident reports, complaints, suggestions, and staffing data. CMS expects the data collection methodology to be consistent, reproducible, and accurate to produce data that are valid and reliable and support all departments and the facility assessment required in 483.70E. It is not necessary to collect all data at the same frequency, and the facility may develop a schedule for routine data collection. For example, data related to high risk or problem-prone issues will generally be collected more frequently, such as daily, weekly, or monthly, until performance is at a satisfactory level, then collected less frequently, such as quarterly or every 6 months. The facility must have policies and procedures in place for developing, monitoring, and evaluating performance indicators, as well as describe how and with what frequency the facility develops, monitors, and evaluates its performance indicators. A performance indicator is a measurement of the data collected, which represents performance in a specific care or service area. Performance indicators enable the facility QAA committee to establish performance thresholds and goals, identify deviations in performance, and evaluate progress. An example of monitoring includes comparing results of facility performance over time, as well as to state or national benchmarks. Nursing homes must develop and implement written policies and procedures that enable the facility to systematically identify and investigate medical errors and adverse events, including how the facility will analyze and use data relating to errors and events to develop activities to prevent future occurrences. As part of its QAPI program, Each facility is responsible for having systems in place and implementing actions which will improve performance. To ensure improvements are achieved and sustained, facilities should implement corrective actions, measure the success of these actions, and track their performance. Additionally, the facility must develop and implement policies and procedures which address how it will use systematic approaches to assist in determining underlying causes of problems which impact larger systems. These approaches may include root cause analysis, reverse tracker methodology, or healthcare failure and effects analysis. Policies and procedures must also address how the facility will develop corrective actions that will make changes at the systems level to prevent quality of care, quality of life, or safety problems, as well as how the facility will monitor the effectiveness of its performance improvement activities to ensure improvements are sustained. As part of its QAPI program activities, the facility must establish priorities for performance improvement activities that focus on resident safety, health outcomes, autonomy, choice and quality of care, as well as high risk, high volume, and/or problem-prone areas. When determining priorities, the facility must also consider the incidence, prevalence, and severity of problems or potential problems which it has identified. If systemic concerns such as repeat survey deficiencies have not been identified or prioritized by the facility's QAA committee, this may indicate that the committee is not effectively performing its required functions. In addition to the improvement activities the facility has identified as priorities, the facility must also track medical errors and adverse resident events. When the facility identifies medical errors or adverse resident events, the facility must analyze the cause of the error or event, implement corrective actions to prevent future events, and conduct monitoring to ensure it has achieved the desired outcome and keeps the outcome going. As part of the facility's performance improvement activities to reduce medical errors and adverse events, feedback and learning must be provided throughout the facility. Educating staff, residents, resident representatives, and family members on medical errors and adverse events, such as what to look for and preventive measures, are important factors in reducing and preventing medical errors and adverse resident events. The facility must conduct distinct performance improvement projects based on the scope and complexity of facility services and available resources identified as a result of the facility assessment required at 483.70E. While the number and frequency of improvement projects may vary, each facility must conduct at least one improvement project annually that focuses on high risk or problem-prone areas identified by the facility through data collection and analysis. The facility's action plans to address quality deficiencies and improve performance may be implemented in a variety of ways, including staff training and deployment of changes to procedures, monitoring and feedback mechanisms, and processes to revise plans that are not achieving or sustaining desired outcomes. The committee may delegate the implementation of action plans to various facility staff and/or outside consultants. Functioning under the facility's governing body, the QAA committee is responsible for developing and implementing appropriate plans of action to correct identified deficiencies, regularly reviewing and analyzing data, including data collected under the QAPI program and data resulting from drug regimen reviews, and acting on available data to make improvements. Surveyors will use the facility task QAPI and QAA review along with the interpretive guidelines when determining if the facility meets the requirements for or investigating concerns related to requirements in F867. Additionally, the key elements of noncompliance for F867 have been updated to include the new requirements discussed. F868 contains a new Phase 3 requirement that identifies the infection preventionist, otherwise known as IP, as a required member of the facility's QAA committee. The IP must report on the facility's infection prevention and control program and on incidents such as healthcare-associated infections identified under the program on a regular basis. Reporting may include, but is not limited to, facility process and outcome surveillance, outbreaks and control measures, communicable illness such as TB or influenza, and the antibiotic stewardship program. In order to be considered an active participant, the infection preventionist should attend each QAA meeting. If unable to attend, another staff member should report on the infection preventionist's behalf, but this does not change or absolve the IP's responsibility to fulfill the role of being a QAA committee member or reporting on the facility's infection prevention and control program. For concerns related to the infection preventionist responsibilities and qualifications, refer to F882, Infection Preventionist Qualifications and Role. As you heard us mention during the training, the Facility Task QAPI and QAA review has been updated to include the new requirements and is available in the Survey Resources folder. Surveyors are to use the facility task at the end of the survey, after completion of investigation into all other requirements, to evaluate the facility compliance and when investigating concerns related to QAPI and QAA. Okay, so let's talk about where the surveyor will investigate concerns related to the facility's QAPI program and QAA committee. For concerns related to the implementation and maintenance of a comprehensive QAPI program and plan, disclosure of QAPI records, and governance and leadership, refer to F865. For concerns related to feedback, data collection, monitoring adverse events, identifying areas for improvement, prioritization of improvement activities, implementation of corrective and preventive actions, and performance improvement project, refer to F867. And lastly, for concerns related to the QAA committee members, frequency of meetings and reporting activities to the governing body, refer to F868. We want to remind you about the new QAPI training requirements in F944. Please view the CMS training presentation and Appendix PP of the SOM for additional information. We have covered a lot of information today, and so we thank you for staying with us. Please remember that this training serves as an overview of the requirements and interpretive guidance, and that the new requirements, additional guidance, and examples are included in Appendix PP of the SOM, which is available on the CMS website listed on the slide. Again, we thank you for taking the time to participate in this training and for your continued efforts toward our shared goal in providing quality care to America's nursing home residents. For questions about requirements regarding QAPI in 483.75, please email the DNH triage mailbox at DNH_triage team@cms.hhs.gov.